President, I've taken a lot of oaths in my Senate service as I've had the proud honor of representing my fellow Utahns and, of course, all Americans across this great nation. And I deliver these remarks with a heavy heart because what could have been a strong bipartisan vote reflecting our collective and genuine desire for responsible reform in the Senate Finance Committee has ended as another largely partisan exercise as we take another step forward towards the flawed solution of reforming 1/6 of our economy with more spending, more government, and more taxes. Now, having said that, I want to compliment the distinguished chairman of the committee, Max Baucus, from Montana, for having worked so long and hard to try and get that bill through the committee. I disagree with the bill, but nevertheless, I recognize that type of effort, and I have a great regard for Senator Baucus and others on the committee as well. But I've worked through almost 4 weeks of debate in the Health, Education, Labor, and Pensions Committee, and now through 2 weeks of strenuous debate in the Senate Finance Committee. I was in the original gang of 7, trying to come up with a bipartisan approach, but I realized that not enough flexibility had been given to Senator Baucus, and I decided to leave that group of 7. And I'm glad that I did, because I predicted when I left exactly what this bill would turn out to be. Now, it almost seems like these hundreds of hours of debate in the past were for naught. It is important for Americans everywhere to understand that the bills that we have spent hundreds of hours working on are not the bills that will be discussed on the Senate floor. The real bill is currently being written behind closed doors in the dark corners of the Capitol and the White House, and we can all hope, well, only hope, that all of us, especially American families, will have ample opportunity, at least 72 hours, to review the full bill and its cost before we are asked to consider this on the floor and vote on it. As a bill that affects every American life and every American business, the health care reform bill is too big and too important to not have a full public review. Now, I want to spend my time today talking about why the Baucus bill fails President Obama's own test for responsible health care reform. Now, this bill is another example of Washington once again talking from both sides of the mouth and using technicalities and policy nuances to evade the promises made to our seniors and middle-class families. First, President Obama, in his own words, has consistently stated, if you like your current plan, you will be able to keep it. Let me repeat that. If you like your plan, you'll be able to keep it. That was given on July 2nd, 2009, right at the White House. And we're all familiar with that particular commitment. One of the amendments I offered in the Finance Committee simply provided that if more than 1 million Americans would lose the coverage of their choice because of the implementation of this bill, then this legislation would not go into effect. This was a simple and straightforward amendment, no nuance, no double talk. This amendment was defeated along party lines. It should come as no surprise to anyone in this committee, or on the Finance Committee, that in a recent Rasmussen poll, the majority of Americans with health care coverage, almost 53%, said that the bill would force them to change their coverage. This bill is rife with policies that will do anything but allow you to keep your coverage. It cuts upwards of $133 billion out of the Medicare Advantage program, which will adversely impact the availability of these plans for millions of American seniors, especially in rural areas. That's what it was designed for. It is pushing for policies at a federal level that actuaries acknowledge could increase premiums significantly for millions of Americans. Not to mention the new insurance tax, which will cost families another $500 in higher premiums. This will make their current coverage unaffordable for countless Americans. American families are very smart. They're very astute. They realize that there's no free lunch, especially in Washington. They're being promised an almost $1 trillion bill. Now, that's really an understatement of what it is, and I'll get into that later, that will not increase deficits, not raise taxes, and not cut benefits. Only Washington Speak could try to sell a promise like this with a straight face. Second, the President has consistently pledged we're not going to mess with Medicare. Once again, this is another simple and straightforward pledge that this bill has now evaded through Washington doublespeech or double talk. This bill strips, like I say, $133 billion out of the Medicare Advantage program that currently covers 10.6 million seniors, or almost 1 out of 4 seniors in the Medicare program. According to the Congressional Budget Office, under this bill, the value of so-called additional benefits like vision care and dental care will decline from $135 to $42 by 2019. That is a reduction of more than 70% in benefits. You heard it right. You heard me right. 70%. I offered an amendment to protect these benefits for our seniors, many of whom are low-income Americans who reside in rural states. However, this amendment too was defeated in the Finance Committee. The majority chose to skirt the President's pledge about no reduction in Medicare benefits for our seniors by characterizing the benefits being lost, vision care, dental care, and reduced hospital deductibles, as extra benefits, not statutory benefits. Let me make this point as clearly as I can. When we promise American seniors that we will not reduce their benefits, let us be honest about that promise. Benefits are benefits. So we're either going to protect benefits or not. It is that simple. And under this bill, if you are a senior with Medicare Advantage, the unfortunate answer is no. You're going to lose benefits. Now, thirdly, the President has consistently stated, I can make a firm pledge under my plan, no family making less than $250,000 a year will see any form of tax increase. That was when the President was a candidate in New Hampshire on September 12, 2008, and he's said that since. Now let us examine the realities of this bill. As I said before, there's no such thing as a free lunch, especially when Washington is the one inviting you over. According to the Joint Committee on Taxation, there are more than $400 billion in new taxes under this bill to continue to fund Washington's insatiable appetite for spending. Now, here are some of the highlights of those $400 billion. $23 billion in new taxes on employers through a mandate that will disproportionately affect low-income Americans, and all at a time when our unemployment is rapidly approaching double digits. Some think we are already in double digits. $4 billion in new taxes on Americans who fail to buy a Washington-defined level of coverage. $322 billion in new taxes on everything from insurance premiums to prescription drugs to hearing devices and wheelchairs. Representatives from both the Congressional Budget Office, the CBO, and the Joint Committee on Taxation, the JCT, testified before the Finance Committee that these taxes will be passed on to the consumers. So even though this bill tries to hide these costs as indirect taxes, average Americans who purchase health plans, use prescription drugs, and buy medical devices, everything from hearing aids to crutches, will end up footing the bill. By the way, it is interesting to note here that although these tax increases and Medicare cuts will start as early as next year, subsidies to help people with their premiums, which will skyrocket under this plan, will not be available until July of 2013, 3.5 years later. By the way, they're going to cut $400 billion out of Medicare. I remember a few years back in 1975 on that budget of that year, we were trying to find $23 billion out of Medicare, and the other side just about went berserk over that. Here we're cutting $400 billion out of Medicare that is already $38 trillion in unfunded liability. So what about the promise of no taxes on families making less than $250,000? Well, look at the evidence. According to the data from the Joint Committee on Taxation and former CBO Director Douglas Holtz-Eakin, 89% of these new taxes will be paid by taxpayers making less than $200,000 a year. The insurance excise tax alone will cost families up to $500 more in premiums. That's not all. The Joint Committee on Taxation also found that at least 71% of all penalties collected from the individual mandate will also come from those making less than $250,000. Like I said, there's no free lunch in this town. By the way, we all know when this bill is fully implemented, it will cost significantly more. Every time Washington tells you that something will cost $1, it usually costs 10. History is prologue. Medicare started off as a $65 billion a year program and now has a $400 billion annual budget. So look for these taxes to only go up in the future, as we have just given the federal government a whole new checkbook. So based on my count, this bill already has 3 strikes against President Obama's own pledge to the American people. He said you could keep what you have. That's not true. No reduction in Medicare benefits for our seniors. That's not true. No tax increases on families making less than $250,000. That's not true. In fact, most of those taxes will go for the middle class, way below $250,000. Lastly, let me talk a little bit about the myth of this proposal actually reducing the deficit by $81 billion over 10 years. Now, here's the harsh reality. Congressional Budget Office recently reported that our national deficit for fiscal year 2009 alone was a shocking $1.4 trillion. That's the highest deficit since 1945 in real terms. Let me put this in perspective. This was the largest yearly deficit since 1945. It is more than 3 times our deficit from last year. Now remember how they were complaining about George Bush and those high deficits? It's almost 10% of our entire economy. George Bush's deficit was less than $500 billion. I thought it was too high. We're now talking about $1.4 trillion in the first year of this presidency. And keep in mind the Democrats controlled the Congress in the last 2 years of the Bush presidency. Now this should send shivers down the spine of every American out there. We are literally drowning the future of this nation in a sea of red ink. Now here's the fantasy. Congress will actually follow through with these massive Medicare cuts that are being used to make this $829 billion spending bill deficit neutral. I challenge a single member of the Senate to tell me when have we ever followed through on such massive cuts. Let me use the words of Dr. Doug Elmendorf, the director of the Congressional Budget Office, on this issue. These projections assume that these proposals are enacted and remain unchanged over the 2 decades, which is often not the case for major legislation. The long-term budgetary impact could be quite different if those provisions were ultimately changed or not fully implemented. Unquote. I could not have said it better myself. We all remember the Deficit Reduction Action of 2005, which attempted to reduce Medicare spending by a mere $22 billion over 10 years. That proposal was mercilessly attacked by the other side of the aisle as being, among other things, as being, quote, Orwellian, unquote, and, quote, immoral, unquote. Now, suddenly we're being asked to believe that Congress will follow through in almost $500 billion in cuts to Medicare. Take another example, the physician payment. This bill only contains a 1-year fix. After that, the doctors will face more than a 20% cut in their payments, seriously threatening access to Medicare seniors. We all know that we have to fix this problem, and that we will. Unfortunately, the hundreds of billions of dollars needed to overhaul this broken system are not included in the score that's supposed to be balanced. And we will go to further increasing our skyrocketing deficits. Let's be honest about it. The reason they could keep it down to $829 billion was by not counting the first 4 years, not having it implemented to as late as 2014. In other words, that's 6 years. If you extrapolate it out to 10 years, you've got $1.7, $1.8 trillion that this bill's going to cost. And one reason it is because they know we're going to have to do the doctor fix. Rather than have doctors paid 25% less by Medicare and even less by Medicaid, and hospitals 25 or 30% less by Medicare and even less by Medicaid. But the biggest bait and switch on the American people about this bill's impact on deficits is a simple math trick. If something is too expensive to do for a full 10-year period, just do it for 6 years. That's what they've done. Most of the major spending provisions of the bill do not go into effect until 2013 or even 2014, coincidentally after the 2012 presidential elections. So what we are seeing is not a full 10-year score, but rather a 6-year score. Now, according to the Senate Budget Committee, the full 10-year score of this plan will easily surpass $1.8 trillion, fully implemented over 10 years the way it's written. And I believe it'll be more than that in actuality when you add the doctor fix to it that we're going to have to do. That's on top of the $2.5 trillion, $2.4 trillion we're spending right now. Now, in our current fiscal environment, where the government will have to borrow nearly 43 cents out of every dollar this year, let's think hard about what we were doing to our country and our future generations. Our national debt is on a path to double. You can see the red lines. That's the projected national debt since this administration has taken over. It's on a path to double in the next 5 years and triple in the next 10 years. There's still time for us to step back, press the reset button, and write a bill that all of us can support and be proud of. Now, Madam President, what is their answer in the end? And I guarantee you, the final bill is going to have some form, it may be disguised semantically, of a government-run plan. That scares every American. Back in 1965, when we did Medicare, the argument was that Medicare will be on an equal footing with the private industry. Well, it didn't take just a couple of years, so they found out they couldn't do it. And so they had to set prices. Today, Medicare pays doctors 20% less and hospitals 25% less, and Medicaid is even worse than that. Now, if you think that the federal government can take over the whole health care system and save money, you haven't observed history, the history of Medicare. And Medicare today is $38 trillion in unfunded liability that we're saddling our kids, our grandkids, and in Elaine, in my case, even great-grandkids with. I'm really concerned about it. This shouldn't be a political issue. We ought to be working together. But I guarantee you, if we turn all of this over to the government, I heard the distinguished senator from Ohio, he's very sincere. He's a very, very loquacious and interesting personality. I care for him. But if we do that, everybody's going to suffer because the federal government cannot do it better. It's just that simple. And we have all the years since 1965 to prove that thesis as well. The fact of the matter is that if we turn this over to the almighty federal government and the bureaucrats back here in Washington, I tell you, it's going to cause a furor like you cannot believe in this country, and rightly so. And I know, I heard the distinguished senator say, well, if the insurance premiums are going to increase because of this bill, let's turn it over to the government and we'll save all that money. Well, what about the $38 trillion in unfunded liability in Medicare as we stand here today? What about Medicaid going into bankruptcy within the next 10 years? There's nobody who doesn't doubt that, who really looks at the financial matters in this country. And the reason they are is because they're run by this almighty federal government. I would much rather see a system whereby we allow the states themselves, who have different demographics. For instance, the distinguished president here today is from New Hampshire. New Hampshire is different from Massachusetts, even different from my home state in Utah. But I'll bet you the New Hampshireites can handle their problems a lot better than the federal government right here in Washington can. I know Utah can. We have a good health care system out there because we do all the things that are necessary to make it good. And it's closer to the people. And the government is closer to the people. And they have to be responsible to the people. I'd like to see a system where we basically block grant these funds and let the states set up their own programs and have 50 state laboratories that literally can show us the way, where we can compare plans, where we can see the good in one state and maybe adopt it to ours. If we turn this all over to a government plan run by Washington, I can't begin to tell you the stifling that will be to innovation and good ideas compared to allowing the 50 state laboratories that federalism was designed to set up. Now, I heard the distinguished majority leader say the Republicans have no plan, they're just a party of no. We have 40 members here. We know we have 6 plans. But we find that even some of our plans are off the charts in cost. Some are not. Fact of the matter is, we know this system needs to be reformed. Every Republican is for reforming the system. We are not for bankrupting the country. We are not for having these almighty bureaucrats here in Washington determine what we all have to do. We are not for turning everything over to the government that's already run Medicare and Medicaid into bankruptcy. We do not believe that the central form of government should control everything. Our founding fathers didn't believe that. That's why they did the Constitution the way they did it. And let me tell you something. Anybody who believes that they can do it better here in a government-run program just hasn't studied history. I've got to admit, some of our colleagues on the other side really do believe that a single-payer system is better. Well, single-payer is socialism, pure and simple. They don't like to call it socialism, but that's what it is. And when you get socialism, you get everything that goes with socialism, and that means rationing. Now, we've got to be reasonable about what services we can give. The states will do it the right way. The federal government will mess it up, I guarantee it. And I don't know anybody who's been around here as long as I have who couldn't acknowledge that. I don't think they should try to dispute that. I think they'd be laughed right out of Washington. And if you want bureaucrats between your doctor and you, this is the way to do it, with a government-run plan right here in Washington, with all the costs and expenses and the oblivious not caring about the future that we've seen year after year after year here. That's why Republicans are up in arms. That's why we can't support this. I wish we could work with our colleagues. I wish we could get together. I wish we could do a bipartisan bill. I might add, one person is not bipartisan. You can call it that, but it really isn't. Although I do deeply respect that one person, and she knows that. Fact of the matter is, we're a long way from having a health care bill. And further fact of the matter is, it won't be the bill that passed out of the committee today. It's going to be even worse. If I was sitting on the Democrat side, I would be worried to death what they're finally going to come up with. They really do, for the most part, the majority, believe that a single-payer system run by Washington, D.C., and the bureaucrats here is going to be better than one run by the states. Now, I have to admit, there are some states that would mess it up, there's no question, and we all can name them, too. And they're generally states that probably are behind the single-payer system. But there aren't many of them. The vast majority of states would show us the way, would help us to find the way, and would help us to do a good job on health care. Well, Madam President, I'm very concerned about this. I'm known as one around here who really does like to work in a bipartisan way, but it's got to make sense. And what we passed out of there today doesn't make sense, and it's going to get a lot worse. By the time they put the Help Committee bill, which was totally Democrat partisan bill, and take what they want out of that, and by the time they take the Tri-Committee bill over in the House, which is a totally partisan Democrat bill, it's going to get worse. And when it does, the American people are going to be the losers. Madam President, I suggest the absence of a quorum.
Clerk will call the roll.